we're all concerned about getting children back to education and doing it safely, making sure our great teachers are safe and our administrators. But the imperative has to be brick and mortar, get kids back in safely. So then you work backwards from that and you say, how many times have we done this? How many times have we reopened schools from a COVID environment, from a pandemic? And the answer is zero. So what we're trying to do is get facts, based on the facts, make the right decisions going forward. And you have to rely on the medical experts, which we have extensively. Have to rely on the local military commanders who have access to the healthcare professionals. You have the CDC, you have the Academy of Pediatrics. You take all of this information, and our great staff and great people have been working 24/7 on trying to get the best practices and come up with the best design to keep children safe in this remarkably complex and unknown environment. So we have a path forward. We have, I think, in place the right things, according to all the latest experts, on social distancing, on wearing of masks, on taking precautions, looking at the environment they're coming from, based on the facts of how many cases, et cetera, et cetera. Make sure there's a testing protocol. What happens to a child if they do get it? In school, what do we do in terms of, we guarantee the buildings are going to be clean to a CDC standard, which is daily. Dividers, plastic dividers at the appropriate places, cleaned at appropriate times, and ensure that we can provide a safe environment. And that's what we're looking for. Ideally, that's what we're looking for, and I think we're on the right track. But we're also being realistic. There are children in medical conditions and health that cannot be placed in what we consider a safe environment because of medical conditions that they may have. Or parents are simply not prepared to have the child placed in a school, which is okay. So we have to address those needs too. So we're developing a virtual school, actually it's the DoDEA virtual school, from K to 12, that will offer parents an opportunity, if they feel after they see what we've done that they're not comfortable, they can go into, at least for one semester, that's what we're requiring, one semester, that they sign up for a virtual school. And they can, it's homeschooling, but it's legitimate, accredited virtual schooling that the parents can help participate and help their child. And I think that offering those two alternatives, I think we can get back to the business of teaching our children.